again, if it's going to be passive, we're going to want the patient's got to feel like we control them, and we try to make this as passive as humanly possible. It's a little bit challenging to make it completely 100% passive range of motion, but you're doing the best you possibly can under these circumstances. So what you're going to do is you're going to take the patient's wrist on the side that you're on and ask them to cross it over their chest, and you can kind of keep your hand right there over them because you're going to want control of their arm. Then you'll ask the patient to take their other arm, put it over both our arms to the other shoulder, okay? That's going to give me an in to be close to them, okay? This is the same issue with the head and neck when we did passive range of motion. When we shifted the body, it was about trying to keep the head over the base of the support. We're doing the same thing now, except now we're trying to keep more of the shoulders over the base of support as we move the person. So once again, I'll just kind of bring my hand in here. And so for what this ends up being is it ends up being a rocking motion, okay, for flexion extension. So nice and tall first, flexed all the way down. So kind of move with me and back and forth, and then on 3 we're just going to go all the way down. Okay, 1, 2, and 3, go all the way down, and I'm just trying to flex his entire thoracolumbar spine as best I can with a little bit of extra overpressure. Okay. For the extension, to me, extension is always the hardest one. He's too tall for me. I'll tell you that. He's too tall for me. For me, he's too tall. So I think, but what you're going to try to do is, what we did with the extension in the neck, we kind of put it at the base of the thoracolumbar spine. Now I kind of put it right at near the base of the lumbar spine, or maybe even like right at mid-lumbar, right where I'm asking him to try to arch over backward. So again, on 3, we're just going to do, come up and over. Okay, 1, 2, 3, and try to, as best of your ability, get him to come up and over. Okay?
How do you not guillotine the person?
Huh?
So how do you not choke the person they're doing?
Yeah. You just gotta be careful.
Be careful. I mean,
He wasn't
hand's gotta
choking.
be.
He wasn't choking.
I mean, there's a space there
Oh, okay.
with my hand and his. Okay, so it's a leverage between this hand and my body, lifting him up and coming up and over. Okay. Side bending now is the same as before, where we kind of pushed his shoulders over. Now I want to push his pelvis. So what you're going to do is you're going to take your hand, place it on the lateral ilium. Okay. My feet are going to change direction now. Instead of being side to side, because I was going sideways before, now I'm going to be going this way with the weight shifting, so my feet are going to be in that direction. My sternum can be up against his shoulder on this side, and what I'm going to do is going to be a combination of pulling him in towards me and bringing him over sideways, okay? So what we do on 3, we're just going to 1, 2, and 3, and I can pull him over and side bend him as best I can. Now he's twisting a lot. Not a very effective demonstration. So I can go first. He likes to slouch. And pull him over sideways. Okay? I need to do better. I need a better demonstrator, but that's okay. We're getting through it. Not you, it's me. I need a high-low table. What I need is a high-low table. Right? Don't blame the patient. You got to work with who you're doing. Rotation is simply just taking your hand. I used to just place it on the other shoulder and simply rotate the person through across for rotation. And then to do the other 2, side bend and rotation, you got to come to the other side. You actually switch your hand placement now. And then it's just the, pull them over towards me. And then for rotation, it's just taking them through that motion, okay? Having the person sit up in neutral is important. If they're already slouched and I'm trying to do a side bend in motion, all of those joints are already locked up. They've already taken up all the motion they have. I'm not going to get the side bend I need. So always making sure the person's kind of starting in that neutral position. I think you'll find out of all of them, this is the toughest to get like that pure passive, feel like the person's completely letting go, but you do the best you can under the circumstances, okay? They should be using their muscular effort significantly less, especially like if we do our active movements. I guess we should have started there. So how do we do active movements of the thoracic lumbar spine? What motions are we interested in? Flexion, right? So when we ask them to bend in flexion, right, we're going to have them come all the way over and then come on back up again. And so the amount of demand those muscles, the extension muscles need eccentrically lowering you and coming up is going to be much greater than what they need when they're doing this in a slouched position. So you are teasing out those muscles a bit, in that sense. So flexion, extension, right? So we ask the person to backwards as far as they can go. Always asking how does that change your symptoms. Side bend and ask the person to stand up straight and tall and go sideways. And then sideways. And the last one's rotation. The thing with rotation that you have to watch is where do they get the rotation from? Are they getting it from mostly their hips, knees, ankles, and my spine doesn't twist all that much? If that's happening, sometimes you can go in with your hands and stabilize the pelvis so you can stand up. And so what I would do a lot of times is turn your face that way. Actually, I always did this from the back. I would watch from here, and sometimes I would just stabilize. And if I knew I was going to ask him to rotate to the right, stabilize the front and the back here. Go ahead, twist as best you can. Come back to the center. And I would just switch my hands and rotate the other way. How does that change your symptoms?
Could you do that just sitting down to stabilize?
You could have them sitting down. It's a different position. I mean, it all depends on what. Normally, because I'm doing active, they're already standing up. So you're already standing there. Let's just see how rotation's doing. But if you felt like that you weren't getting a good stabilization, or you could have them sit down, and that would stabilize their pelvis. But you got to make sure then that the chair's not restricting their motion and ability to twist as far as they can.
And so you direct the patient to sit up as much as they possibly can, but isn't that like using muscle?
Yeah,
as well?
yeah, it is. But then, so then in the actual movement itself, I need him sitting up a little bit to begin with, and then on 3, we're just going to kind of go over together, and then he kind of relaxes out as best he can. That's what I said. I said this is probably the hardest one to get pure passive. It's really tough, but it's better than not doing it or doing nothing. Resisted range of motion, just like in cervical.
Yeah, can I just say something about that? One of the